Good afternoon, everyone, and welcome to today's program, Mental Health in the Workplace, a Capital Blue Cross presentation. I'm Nicholas Cunningham, the Program Manager of LVAIC. We have a great presentation for you today. Gina McDonald from Capital Blue Cross is joining us to talk about how we can take care of our mental health in the workplace. Before we begin, I have a couple quick housekeeping announcements. First, please be aware that we are recording today's session. Secondly, please feel free to put your questions in the chat throughout the presentation, as we'll be answering all the questions at the end of the presentation. We will pause the recording during the Q&A to respect everyone's privacy. And now I'm going to turn it over to Gina, please.
Wonderful. Thank you, Nicholas, and welcome everyone. As I usually say, is if people are waiting to come in, we have our fast fact on the screen. And the kind of gimmick around that is, as movies have trailers, we have fast facts. So again, we're promoting our My Care Finder tool, which you can find behind your secure member account. And we'll be getting into that in our resources coming up later. Moving on, as Nicholas shared, this is Mental Wellness in the Workplace brought to you by Capital Blue Cross. My name is Gina McDonald, one of the senior health coaches, and I'll be your facilitator for today. Let's take a look at our agenda to see what's going to happen. First of all, we're going to describe and identify symptoms of stress. We'll be going through physical and emotional symptoms, then identify strategies to cope with stress. We'll have some management techniques and also look into those healthy behaviors to see how they can assist with stress also. Then, I kind of like to say with this presentation, we have stress on the first half, then we'll be segueing into depression. And that'll be our lead in with discussing causes of depression. And then we'll get into how depression actually affects the workplace. We have a few slides of resources also at the end.
Bye,
And as
Adam.
Nicholas
Thanks for your help.
Oh, it looks like we have somebody. We can please mute all lines. That would be wonderful. So, and again, as Nicholas shared, if you have a question, please feel free to put that into the chat. I also have, I believe, two test your knowledges coming up. I like to always say, let's fire up that chat box if you would like to participate. That'll be coming up shortly. But first, let's get into our definition of stress. What is stress? Well, stress is a word that is thrown around and used quite often and in a variety of different contexts. And by definition, it's your body's physical, psychological, and emotional response to anything you perceive as overwhelming, troubling, recurrently irritating, or upsetting. Additionally, stress is a state of mental or emotional strain or tension resulting from adverse or very demanding situations. Well, that's going to be our basic definition we're going to work with. So let me hear from you again. If you would like to light up that chat box, we got two true and false for you to start off. 50% chance to be right or wrong. Let's start off with number one. True or false, during a fight or flight situation, the body prepares to defend itself. It takes about 20 minutes for the metabolism to return to normal when the response is over. I'm pulling up that chat box. I would love to hear from you. What do you think about that? True or false? True or false? We have a true coming in. We'll see if we get anything different. We got two trues coming in. This seems like it may be true. Thank you very much for playing, everyone. We'll get the answer out right now. It is actually false. So if you are in the audience thinking it was a false statement, you are correct. The reason why it's that whole 20 minutes within that statement right there. It takes about 90 minutes for the metabolism to return to normal when the response is over. The fight or flight response is our body's natural survival instinct to protect and defend ourselves very quickly when there's no time to think about what's about to happen. All right, we got one more. Let's give it a little click on that screen and it should come flying in. Here we go. True or false? We would all be better off if we had no stress in our life. What do you think about that? What do you think about that one? Amy, I think you're playing. Yes, excellent. We got the falses coming in. Fantastic. Thank you everyone for participating. I just like to know everyone's out there paying attention in the audience. So wonderful. Thank you again. And if you answered false, you are correct. False. I should say stress is natural and in small doses is healthy for us. For immediate short-term situations, stress can be beneficial to your health. It can help you cope with potentially serious situations like fight or flight, and your body responds to stress by releasing hormones which increase your heart and breathing rates and prepare your muscles to respond accordingly to whatever situation you're in. So, again, thank you, everyone. We're going to keep moving forward. Let's get into those symptoms when we're thinking about stress. We're going to kick things off, though, with those physical symptoms. Stress is fascinating in that it can have an impact on the human body in so many ways. There are a number of physical symptoms listed here, and you may have heard of or experienced more that even aren't listed, such as sleep issues, headaches, constipation, and its reverse cousin of diarrhea. Now, no energy, changing in eating habits, flare ups in existing chronic conditions such as asthma and arthritis, muscle tension, stomach cramps and bloating, skin problems, weight may go up or down, issues with the heart or blood pressure, and development or increase in neck or back pain. So, again, to review these physical symptoms to see if anyone's are more pertinent to you, or like I shared before, maybe you have some that aren't even on this list. As we have the physical symptoms, let's now go into those emotional ones. Take a look. We have another long list here on the slide. Similarly, the emotional symptoms are just as varied: anger, sadness, irritability, depression, anxiety, reduced desire for intimate relations, unable to concentrate, forgetfulness, worry, crying, withdrawal, frustration, and nervousness. Now, again, if you have some symptoms that maybe affect you and kind of want to share those, please feel free to light up that chat box. Zoom always alerts me when something is coming in. So again, we just had the physical and now here are the emotional to kind of get into what can actually happen in the body when stress affects us. Also, something too is, and we're going to get on to those ways to manage stress and also thinking of our healthy behaviors. We get there, and I flip the slide, what I want you to take into account is that we have acute stressors, meaning things that kind of come on suddenly. Maybe you get like kind of like an irritating email, or you're driving along really calm and then someone pulls out in front of you. Those could be those acute stressors. Then we have chronic stressors. When we think about chronic stress, that's something that's bombarding you day in, day out for 3 months or longer. 3 months or longer. Let's see, we had something come in. All right, I think that was just a note from Zoom. We'll keep on going. So again, let me flip the slide now that we have in place. We have our knowledge of our acute and our chronic stressors. So when we think about these management techniques, kind of think, well, could I use that in an acute situation? Or would this be better for long term? Or maybe both. So again, let's take a look at those ways to manage your stress. Because again, thing is, stress is a normal part of life, and we can't necessarily eliminate it, but we do want to better manage it. Now, the key is to find the technique that works best for you. Let's take a look in deeper here on this list of the slide. You can even start with just stretching exercises, getting up out of your seat and just moving your body, especially remember on that previous slide about the physical symptoms, we talked about that neck and back pain, kind of right at the base of the neck. A lot of times with those shoulders coming forward, they like to creep up to the ears. Ooh, that's where that pain is going to be. So nice stretching. Even if you don't even want to think, I don't even have time, Gina, to get up and stretch. One simple thing you can do, lift up those shoulders, roll them back, and drop them up, roll, drop. You can also help your parasympathetic nervous system by just doing that. So again, make it work for you. Let's go into deep breathing. This helps you can feel connected to your body. It brings your awareness away from the worries in your head and quiets your mind. And that's where you can get into also some focused breathing. Kind of think of that mindfulness where kind of taking everything out of the picture and just focusing on that inhale, nose, pause, exhale, mouth, pause. I like 4 counts. So I'll inhale 4, pause, exhale 4. And it kind of becomes very rhythmic and soothing. So think of it like that can work for you. Meditation. It's calming and allows you the time to choose what thoughts you want to come into your mind and to take action. There's a lot of different meditations out there. I know myself, I like mindful meditation, just focusing on my breathing and the now. My partner, they do transcendental meditation where they actually kind of focus on problems and really just focus there on different lenses and approaches for that problem solving. So again, find what works best for you. Prayer. No matter what religion or faith you have, prayer or spiritual routines increase activity in the brain. And that's also associated with social interaction, compassion, and sensitivity to others. Progressive muscle relaxation. Again, you may have heard this, and especially if you have a meditation app that you like. And hey, if you would like to share the app you use within the chat so you can share the wealth with everyone, that would be fantastic. But with progressive muscle relaxation, we kind of go from head to toe, picturing different muscle groups and tensing them and then releasing and to see what tense muscles really feel like, and then that soothing relief of when they're relaxed. It's better to start with possibly a guided progressive muscle relaxation till you get the flow. And it's great to hold that kind of tensed up situation for 5 seconds and then release. Just what I did there. Ooh. Practice some progressive muscle relaxation. I saw something come into the chat. All right. Thank you very much. We got Insight Timer being promoted. I have a lot of people that's a big fan favorite out there too. And the only thing I also ask, I forgot to mention this, if you use it for Apple or if you know it's also available for Droid, if you could put that along with it, that would be great. And if there's a cost. So I know one of my favorites is Medito, Medito. And why? Because I searched 100% free guided meditation and it came up. And what do you know? Fantastic. Just not a lot of bells and whistles, but it has everything in there and it's free for Droid or iPhone. Thank you very much for sharing that recommendation. And again, we all help each other through this. Visualization, can't say enough about it. This is where you form a mental image and take a visual journey to for a peaceful, calming place or situation. Try to use as many senses as you can, smells, sights, sounds, and textures, and imagine relaxing and bringing those visuals to the forefront. I know for myself, the way I add this into my day, each day, I do a daily visualization after my dog walk, and I do it with my 2 dogs underneath each one of my hands. And I map out how I want my day to progress and ask everybody to give me energy for that day. So that's how I consistently use visualization. Definitely can be used as a calming technique, but wanted to put that out there. If you wanted to see your day moving forward positively, you have control over that too. We have something coming into the chat. Thank you very much for the follow-up for Insight Timer. We got free on both Apple and Droid and offers a paid subscription for more features. You know what I always say about the paid ones is try out all the free benefits as you can through the apps. And then if you feel it's worth it, then do the buy up. Thank you for the buy up information. That's like our headspace and our calm. They're great. They have free options. They also have a lot of buy ups, a lot of lockdowns. So again, see what works best for you before putting those dollars out. A lot of variations are out there. Thank you very much. Also, guided imagery. Now, this is the one that I like to see more of like kind of picturing the setting. And what I always say is make sure that it's a setting that's approved for you. A lot of times with group guided imagery, it's hard to find one setting where a person in the audience doesn't have a negative reflection. I found this out from just talking to multiple people of experiences of descriptions of water, such as at a creek. I had a friend who was like, I just pictured spiders everywhere. And I'm like, nope, didn't get that at all, but interesting. And then the ocean ones, there's some people who just do not like sand, and it's more stressful to think about all the sand on them. Again, pick an imagery that brings you peace and most of all, something that I just love to add to my life all the time. Joy. Yes, let's add as much joy as we can to our life. Can't say it enough. Group support. And whether that comes formally or through friends and family, making sure it is there for you. Well, those are the various techniques that we can add into our lifestyle, but also just our simple, healthy behaviors. They have an impact also. Let's go through each one of these too. So, again, relax. Sometimes this is a lot easier to say than to do. And relaxing, it's making that conscious effort to breathe deeper and let yourself relax when you begin feeling tense. So many people say, I have no time. I have no time. Start small. And that's where it may be setting timers for just a minute and knowing that minute is only for you and then growing from there. Same thing with the make time for yourself by taking just time every day for about 20 to 30 minutes of you time. And in the span of 15 to 17 hours awake, when you think about it, 20 to 30 minutes is not a lot of time. That you time can also, as you can see, we're going to come down to a few bullets. That could be your time for exercise too. I mean, I treat my exercise as a reward. We'll get into those recommendations soon. But first, one of the biggest recommendations, as I've heard it described, your best return on investment for your health, and that is going to be sleep. Again, the recommendation for adults, we're looking at 7 to 9 hours, but it's not just about the quantity, but it's about the quality. So let's make sure we have routines put in place. That's like my first basic question I ask someone when they say they don't sleep well. I say, well, what does your sleep routine look like? And they're like, Gina, I go to bed. And I was like, well, does your body know it's preparing to go to bed? And that's where that consistency can really come into play, developing those routines. Kind of then you're cueing your body to say, hey, it's bedtime. We're going to be heading there very soon. And then making that bedroom a place for sleep, very dark, possibly cooler in temperature. They like to say that 65 degrees is that sweet spot for sleeping. So, again, if you have issues sleeping, though, a lot of times people push it off and they say everybody sleeps bad. No, they don't. So, please have that conversation with your healthcare provider. Eating well. Yes, a diet rich in fruits, vegetables, and whole grains. I get very excited talking about those three things. Why? Those are also going to be your sources of fiber. Fiber in life will be a proponent to keep you well and to push away a lot of certain conditions. So, again, make it your best friend out there. Also, low fat dairy and lean meats can help boost your immune system and leave you better able to cope with life's demands. If you're sitting in the audience saying, Gina, where do I even start when I start thinking about my diet? First, I always say is get your foundational facts. Where can you get those? MyPlate.gov. Great little snippets about each of the categories of food, how beneficial they are for you, and how you can put them into your lifestyle. So you can actually personalize your own plate. Again, that's at myplate.gov. All right, let's talk exercise. One of my favorite things to talk about is exercise. 150 minutes of moderate physical activity per week is recommended for not only those heart benefits, but that's when our mental wellness benefits start kicking in also. What do I mean by moderate activity? Well, we have a few physiological signs if you don't want to be keeping track of your heart rate, and that's simply going to be if we have a little sweat, talking becoming a little difficult, and heart rate rising. When we have those happening, that's usually when we're going to get in that moderate zone. I also like to say walking, weight bearing exercise, one of the best things we can do for our body if you're able to. And if you want to think if you're walking at a pretty good clip, one of the best kind of little mantras I have going to my head when I'm walking is, you are late for the most important meeting of your life. Pick it up. And that's a question I'll ask myself, especially when I know I need to walk fast. I'll be like, are you walking as fast as the most important meeting of your life? So again, keep those little cues in your head so you know that you are getting in that moderate zone. And the way I also like to describe it is movement with intention or movement with dedication. So again, those are some little cues to think, hey, am I really kind of moving my body the way it should to get those benefits? Also, talk. Talk to your friends and your loved ones. What is your social circle? And make sure it is plentiful in your life. When I say plentiful, it doesn't mean you need hundreds of friends. You need those friends that you can friend, possibly you can count on and be there for you. Same thing with family. Sometimes friends, for some people, count as family. So again, think about talking to your loved ones and keeping them close. Also, saying no, the hardest two-letter word there is for so many people to say. And it's about knowing those limitations and saying no without guilt. Anytime I see the word guilt, I always like to pass on kind of like a little phrasing that someone shared for me that their mother had taught them. And they said, Gina, guilt is a useless emotion. If you do not like the way you are feeling at the present time, then do not repeat your behavior. And I'm telling you, you know, when that came into my life in 1996, I can even tell you where I was standing. Like literally, it's so vivid to me. But that really, really changed my thinking about that word. So anytime that I kind of even have those feelings of guilt, you better believe it. I'll say, we're not going to repeat this behavior because we're not going to feel that way again. So again, know your limitations. Sometimes we have a hard time saying no. And then what happens? We're stretched in so many directions. And then we're not really putting our best selves forward in the first place. So that's going to wrap up our stress. We have a lot of different techniques and management ways that we've gone through from formal to our healthy behaviors. So there's a slew of things to add to your lifestyle if you feel gaps are there. And remember, it doesn't have to be all at one time. Maybe trying out some things and seeing how they feel for you can definitely be your way to move forward. With that being said, we're going to segue into the second part of our conversation today. And this is where we're going to touch on depression. So, when we think about depression, let's get into again those definitions so everybody's on the same page. Definite depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with a person's everyday activities. When someone has depression, there may be problems with activity levels in certain parts of the brain or chemicals in the brain called neurotransmitters that may be out of balance. You know, the first time I ever heard of depression, did not know about that. Um, and it was dealing with my ex-husband at the time, who came back from the war, and we were having some challenges with that. And, you know, it is something that a lot of people want to deny. And then we finally realize, hey, this is happening because of balances, chemical balances, imbalances that are in the brain. Now, by definition, again, depression is an illness that involves the body, mood, and mind. It affects the way a person handles everyday things, and people experience depression in different ways. It may interfere with your daily work, resulting in lost time and lower productivity. It can also influence relationships and impact some chronic health conditions. Now, we're going to have some more stats coming up because we have another test your knowledge soon on deck. But in general, about 1 out of every 6 adults will experience depression at some time in their life. Depression affects about 16 million American adults every year. Anyone can get depressed. And depression can happen at any age and in any type of person. Now, many people who experience depression also have other mental health conditions. Anxiety disorders often go hand in hand with depression, and people with anxiety disorders struggle with intense and uncontrollable feelings of anxiety, fear, worry, and or panic. These feelings can interfere again with daily activities and may last for a long time. Now, what causes depression? We have a few things to keep in mind here. First of all, family history. You're at higher risk for developing depression if you have a family history of depression or another mood disorder. Early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Medical conditions. Certain conditions may put you higher risk for chronic illness, insomnia, chronic pain, or attention deficit hyperactivity disorder. Drug use. A history of drug or alcohol misuse can affect your risk. You may have a greater risk of having a bout of depression again if other family members have had it. In this case, a stressful event life could trigger depression, such as a death in the family, divorce, or sometimes even happy occasions can trigger depression due to the amount of stress, such as a marriage with wedding planning or even a job promotion. And how you routinely think can affect how you feel. What is that called? That's called the mind body connection. So, thinking in extremes, such as I can't do it perfectly, I should just quit, or if I make a mistake, I'll be fired, that can be a hindrance. Also, being diagnosed with an illness or lifelong conditions, for example, diabetes or heart disease, can trigger a bout of depression. Specific health problems, such as hypothyroidism, which is an underactive thyroid, and anemia, can cause depression. And finally, the stressors of a serious loss, difficult relationship, financial problems, or life change can also be an opening for depression. Now, as with stress, we had symptoms listed. Same thing we're going to do here with symptoms of depression. So the symptoms vary, such as irritability, hopelessness, speech becomes slow, sadness, suicidal thoughts, feeling of restlessness, changes in your sleep, appetite, and weight, and the ongoing physical symptoms that just aren't going away with treatment, like headaches or other ailments. The diagnosis of depression isn't just as straightforward as identifying one or more of these symptoms. Rather, your healthcare provider would talk with you to find out the duration of your symptoms as well as the level of impairment the symptoms have had on your everyday activities. Now, as we had just symptoms of depression, let's see how those symptoms of depression can actually exude themselves in the workplace. So many of us spend most of our waking hours a week at work. So it just makes sense that stressful situations either stem from our work environment or we're bringing our stress and all that goes with it to the workplace each day. And with those hours spent working, the symptoms can be quite debilitating. The red flags can include decline or change in decision making, reduced productivity, unable to concentrate. Maybe you're not quite as dependable as you used to be. Could be that you're making more mistakes or accident prone. Frequently being late or calling in sick more could also be some symptoms of depression. Now, as we had our test your knowledge before, again, if you would like to play, if you can please light up that chat box, we have our first true and false already on the screen. So here we go. In any given 12-month period, nearly 10% of the population will suffer from a depressive illness. And we have something coming in already. We got both a true and a false. So this will be a nice one, friends. We got more trues coming in. Thank you, everyone, for participating. This is wonderful. Well, actually, if you answered true, you are correct. So that again is true. I know maybe somebody who's in the audience going, Gina probably put that 10% in there, and that's probably the wrong guy. So, nope. Actually, this one, we do have a true statement. We got one more. And this is going to be about symptoms. Here we go. Depression affects mostly educated middle-aged men of any economic or social status. What do we feel about this? Yeah, the falses are really slamming in. Fantastic. Thank you, everyone. There's such active participation going on in that chat. Fantastic. If you answered false, you are correct. It affects both men and women of any age, education, economic, or social status. Remember when I said to you I was going to have some more stats? Here we go, right there for you. Take a look at those. And as you can see, the dates there, of course, one of these dates coinciding with, you got it, after COVID. So during August 2020, February 2021, the percentage of adults with recent symptoms of an anxiety or a depressive disorder increased from 36.4 to 41.5%. Now, also too is take a look at the increase and what ages those were. So again, some more information about how this is not just affecting, older people, younger people, it is affecting across everywhere. Now, let's start first with depression in women. Now, both men and women are affected by depression. However, women are more susceptible to suffer from depression. You might be sitting there and go, why? Well, listen to this. Changes in female hormones, such as estrogen and progesterone, during the menstrual cycle, pregnancy, postpartum, perimenopause, or menopause, may all raise a woman's risk. In the unfortunate situation of a miscarriage or stillbirth, a woman may also be at a higher risk for depression. Any additional life stresses can lead to an increased risk, and depression is not to be considered a normal part of being a woman. Most women, even those with severe depression, can get better with proper treatment. Oh, always put that line in the back pocket right there. Now, if that's depression in women, let's take a look at depression in men. Now, symptoms can be very different for men and women. And at times, men show more signs of aggression and anger instead of sadness. Men are also less likely to seek treatment. I know I'm having a challenging situation in my life. You can't force somebody to go get help, but I'm seeing this with a family member, and it's so challenging because I know that's their first step to kind of help all the other things that are going on. Also, they may be more likely to have difficulty sleeping than women who have depression. Sometimes mental health symptoms show up as physical issues. For example, a racing heart, tightening chest, recurring headaches, digestive issues. Many men are more likely to see their doctor about physical symptoms rather than their emotional symptoms. Now let's get into that diagnosing depression because as we learned on that previous slide, it's really not as easy as you think when we're talking about the signs and symptoms. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. I mentioned about the variety of symptoms that could come to the surface from possible depression. Therefore, any of your physical symptoms would be addressed and treated appropriately. And then included in a physical exam could be lab tests. These would look at a complete blood count or the thyroid. Remember, we had that before. Your healthcare provider would review all the information provided from a physical and mental exam and identify if that meets the criteria from within the publication called the Diagnostic and Statistical Manual of Mental Disorders, also referred to as the DSM-5. Now, the number 5, that refers to the version that is currently on, and it's published by the American Psychiatric Association. Now, getting to a clear diagnosis is tricky, as there are several disorders and have depressive symptoms. So the process of diagnosing is not always as straightforward as what many of us have used with our physical health. However, getting to the right diagnosis is so important to ensure that appropriate treatment. Also, that last bullet, there are patient health questionnaires, also called PHQs, which should also be reviewed by a healthcare provider. So, again, a lot of great information there on how to get that diagnosis. But again, you are not alone. Check in with your healthcare provider. Let's talk about those treatment options for depression. We're going to go through a whole slew right here. Now, again, starting off with a stat, 80% of individuals with depression can be successfully treated. And it's among the most treatable of all medical illnesses. However, only 20% of depression sufferers currently receive appropriate care, and 60% remain untreated. There are several forms of prescription medications. Now, again, I am not a pharmacist, but I would like to share what some of those forms are to you, such as norepinephrine serotonin reuptake inhibitors, selective serotonin reuptake inhibitors, also known as SSRIs, tricyclics, monoamine oxidase inhibitors. These type of medications must be taken for 4 to 9 months or longer to prevent reoccurrence of depression. And the effects of medication usually aren't seen within 2 to 4 weeks. I should say are seen within 2 to 4 weeks. That's why to continuously take that medication. They're effectively only if taken as prescribed. They're not addictive, but withdrawal problems could occur. Mild side effects are common and often improve after 1 to 2 weeks. Let's go into those herbal remedies. They may include St. John's wort, which is most studied and most commonly used treatment for depression in Germany. Also, ephedra, ginkgo biloba, echinacea, and ginseng. But just be aware, these are herbal supplements and are not regulated by the FDA and can have dangerous interactions with other medications. And simply different people react differently. So it's extremely important to research and discuss with your healthcare team before just taking any herbal remedies. This happened in my own household. I was talking to my partner about a specific herb, and he was going to the doctor. And I said, "Oh, could you check in with your doctor while you're there about this supplement?" He's like, "Well, Gina, it's only a supplement." I'm like, "Exactly." So this common knowledge, I should say, it's not common knowledge to a lot of people that there could be some contraindications. People just think it's only herbs. It's not going to affect my medications. Always have that discussion. Keep yourself safe. Psychotherapy. It's treatment that has been shown to be as effective as antidepressants in treating depression. It can be done individually or in a group, and the majority of individuals in psychotherapy sessions meet once a week for 6 to 20 weeks. Finally, again, one of my favorite topics to talk about, exercise in whatever form you choose. And it must fit your lifestyle. That's that famous question. What's the best exercise, Gina? Well, the exercise you're going to enjoy doing consistently for the rest of your life. That's going to be your best exercise. Moving your body. It loves to move. Absolutely. And it's truly the remedy virtually for all ailments. I always like to call it the magic bullet for health. Research shows that regular aerobic exercise can help improve symptoms of depression and anxiety and be just as effective as treating mild to moderate depression as antidepressants. And improvements can show by incorporating that whole 150 minutes of moderate physical activity into your lifestyle. So, again, talk to your healthcare provider about how you can incorporate exercise, maybe along with your medications, and see how everything works together. So, maybe it's not a one or another, but how some of these can work in contingency with each other to make sure it works the best for you. Okay, here we go. The importance of taking your medication. Can't say it enough. Take your prescribed antidepressant medication to ensure you receive that full benefit of your treatment and continue taking your medication unless otherwise directed by your healthcare provider. Remember, we talked about just on the previous slide that it could take up to 2 to 4 weeks for these medications to start having an effect. So, what's happened sometimes? People take them for just a couple of days and go, "Ah, I'm not feeling any better. I guess I'm going to stop." So again, we got to let them work. So please always have that discussion before you go off any medications with your healthcare provider, just as the same as you know exactly how to take them correctly in the first place. Well, we have talked about how depression can affect you, but now let's talk about how depression can also affect the workplace. So, we're going to take a look now at those effects of stress and depression in the workplace. And we had that slide about the different symptoms. So, you might reflect a little bit on that too. It can cause that poor productivity, absence from work, and also absent from your work, even if you're not physically there, also called presenteeism. Yes, being at work, but not actually doing your work. That's when you're at work and again, not really doing it. Sometimes people just can't pinpoint why they don't like their job and come to find out it's really not all about the job, but the underlying issue has been their mental health. And then there's a greater chance for making mistakes and accidents. And there's certainly the family component of bringing the distractions from home again to the office. Now, take a look at this slide. We're going to have more of a text information coming up right after this. What this is just showing is just how we have mental illness and we have chronic disease. And guess what? There's a huge overlap in both of them. So that's just showing a diagram about that, kind of just talking a little bit so you can take a little peek at those numbers there. Again, when we go to the next slide, we're going to have a little bit more information about this. So again, check that out. Now, let's get some more information there. There's a high prevalence of mental disorders and chronic conditions, meaning when there's one, there could be another, but not in all cases. Having a mental health disorder is a risk factor for developing a chronic condition and vice versa. So the pathways causing the comorbidity are complex and can go both directions. Another thought is that depression can produce a slower immune system, therefore, not preparing the body to combat other illnesses. Now, risk factors for depression and chronic conditions are also shared, such as tobacco and alcohol use, obesity, poor nutrition, little exercise, and inadequate medical care. Now, what can you do for someone with depression? A National Mental Health Association survey found that depressed employees do not seek treatment because of the following. They believe they can handle it on their own. They may be unaware that they have depression. They're concerned about their employee confidentiality. They believe their insurance will not cover treatment, and they fear the overall effect it will have on their job. When talking to someone who is going through a difficult time, not saying anything at all or avoiding the person is the worst action you can take. Even if you don't have what you believe are the right words to say, it's better to say something or start by just listening to them. Encouragement, support, and an open ear is best. Instead of telling somebody, you should just snap out of it. Read their cues. Don't be too pushy, but simply be enough to ensure that they know that you're there and you're not ignoring what they're going through or not brushing it off. And you can clear up. It's just something that they can clear up in a few days, like the common cold. Every time I get to this slide, I have a reflection. It's so crystal clear in my head. When we were in the office, I was at our Elmerton location in Harrisburg, and I usually would be in the fitness area, and that's in our basement. And I call them the secret bathrooms of Elmerton. And I would always go to this one bathroom. And because there usually was not a lot of people there, but all of a sudden I'm washing my hands and there's another woman and who's there washing their hands also. And I just look over and I'm like, hey, how you doing? And they're like, not good. And I just immediately stopped and I looked at them and I said, do you feel safe right now? Or what's going to make you feel safe? And they were so surprised that I didn't just say, oh, okay, brush them off. And I can almost like feel myself tearing up because they felt heard. They didn't want me to do anything. They just felt heard. So again, listening, remember that whole kind of paragraph I read? Just listening to someone, being that ear for them, making them feel seen can be sometimes good enough at that present moment. Always wanted to share that little anecdote. As I shared before at the beginning of the presentation, you got a lot of resources for yourself. Here are just some local resources to look into. Depending on the situation, person, and location, there are a number of resources available. Here's a basic list to give you ideas where to begin. And again, our employees at Capital Blue Cross, we have an employee assistance program, an EAP, where we can also get guidance and support. So again, look into your employer to find out if an employee assistance program is available for you. Also, thinking about virtual care, if that's also available within your benefit package, there is behavioral health services available there too. Now, taking a look at those national resources, if you kind of heard something during this presentation, you might want to look deeper into for yourself and to get some clear definitions. That's where we can go into some of these resources that are listed here. So again, check this out. Maybe even take a little screenshot if you'd like. I'll give a few moments for you to review this. We're going to move on then to our Capital Blue Cross resources. I know we have some questions coming in here. Just okay. Okay, great. And it looks like we have one question to save, but we have some feedback to share also. So let's get the feedback in. We'll save the question for when the recording is stopped. So just adding in terms of diagnosis, it helped me to learn that there's major MDD and persistent PDD depression. One can be milder but long lasting. Just a reminder that you don't have to be at your worst to get help. Thank you so much. Great information sharing. You know what that felt like reading that is that we're all in this together. We are here to help each other. So thank you very much for sharing that. Very appreciated. And again, when the recording's off, we know we have one question that's still in that chat. Let's get through these resources. Then we'll have Nicholas stop the recording. We'll be good to go. So taking a look at our resources here on the screen, remember right at the beginning, I shared about creating your secure member account. Yes, I believe that was on the fast fact slide. So that was really at the beginning. That's where you're going to go to capitalbluecross.com. In the top right corner at our homepage, you'll see either register or log in. If you need to create your secure ID and password, please have your health insurance card available. There will be some questions about that for you to input the information. Once you create your user ID and password once, you're good to go forever, and you'll have that login created. That is your gateway to your health and wellness resources, amongst also your benefit information. Now, some of those health and wellness resources include Blue 365. This offers wellness and health deals exclusive to you as a Capital Blue Cross member. Blue 365 offers discounts on fitness, personal care, healthy eating, financial health, lifestyle, and wellness. My Care Finder. We had it right at our Fast Fact. Search for doctors, specialists, facilities, get treatment cost estimates, and find treatment timelines. I always say is I have found my dermatologist, podiatrist, and a chiropractor on My Care Finder. Great intuitive tool. So use it as much for your benefit as you can. Capital Blue Cross Virtual Care if it is available for you within your benefits. And finally, care management. This is the whole thing where sometimes it takes a team to help manage your health, and the Capital Blue Cross Care Management team is on standby to help you with complex medical needs, including maternity care, cancer treatment, chronic conditions such as asthma, diabetes, coronary artery disease, and congestive heart failures, and also medical transplants. I know myself, I use care management services the beginning of this year. I had to schedule a surgery and I never scheduled surgery before. And I was like, oh, I want somebody with me along this route to keep me accountable and make sure I'm doing all my proper steps. So I self-referred. Yes, I did. I called that number that's right there on the screen. Actually, I called the number, I believe I called member services and been connected that way too. My point is, you can self-refer, or if you do get a phone call from care manager, pick it up. It's great to have that little partner taking you through your health and wellness journey. I got one more slide of resources for you. Capital Blue Cross Connect Health and Wellness Centers. We have four here in central Pennsylvania in the Saucon Valley for my Lehigh Valley participants that are out there. We also have them in Enola, Chambersburg, and York. This is where you can really get benefit information, but it's more than just insurance. This is where it's our wellness wonderlands. Get your free biometric screenings, also including body composition analysis, health coaching services, personal training. Also, speaking of exercise, free fitness classes streaming at Capital Blue Cross Connect. Check out the website, schedule an appointment, take a fitness class, see what services are right for you. Omada, diabetes prevention, like a weight loss program. You get that free scale that we hear so many kudos about. Also, Omada diabetes management, free support and supplies. Also, Verta. Any information on any of these um, diabetes programs, please look at capbluecross.com/diabetes. Finally, Ovia. Women's Health and Family Digital Tools. This is going to take you across the whole spectrum of women's health from fertility to pregnancy, parenting, and perimenopause and menopause. And especially remember we were talking about menopause, possibility fortunately of miscarriage or stillbirth. And that's where you want that emotional support, more additional support. Take a look at Ovia, and it's all app based right at your fingertips. With that being said, again, we have some app recommendations here. Capital Blue Cross does not endorse any apps, but we do like to give you information about different ones you can research on your own. As we had Insight Timer also promoted within our chat. And then also I shouted out Medito. That's my favorite one. I've tried Calm. I've never been in Headspace. I've tried Calm and I like what's there, except I can get it free. All the things that are in Calm with less bells and whistles in Medito. So that's kind of how I go there. Just if you're looking away around the buy up areas from there. And with that being said, we have our disclaimer, and I'm just going to give a big thank you. Nicholas, I'll cue you if you would like to end the presentation, that we can get to that one question that is in the chat.
All right, yeah. So we'll get to Q&A right now. So I just want to thank Capital Blue Cross, Gina specifically, for such an informative presentation. I'm going to be dropping some LVAIC links into the chat for our upcoming events. We have some great things coming up. We have a virtual LVAIC graduate fair coming up. We have Estate Planning 101. So please follow the links. And thank you for joining this presentation. We'll have the recording and present and slides up on the website, and I'll stop the recording now so we can do our Q&A. Thank you, everyone.